Tummy tuck scar expectations. Huge topic for tummy tucks, right? Everybody hates the tummy tuck scar. Listen, I don't want to put a big incision on you as well. But it's typically when you need a tummy tuck, you need a tummy tuck. And the purpose of it is, again, you got to understand this. It's really about skin laxity, skin excess, stretch marks, abdominal tone. Like those things just aren't going to be corrected with just liposuction alone. If you have extra skin, you just have extra skin. It's just the way it is right now. So tummy tuck really addresses all these issues in one procedure. Very, very powerful procedure. With that said, the scar is dependent on several things, right? So it depends on how much skin is removed. Scar placement or where you put it is typically very surgeon dependent. So those are the kind of things you want to talk to your surgeon about. What's my scar where is it gonna live? What do you think it's going to look like? People's genetics come into play as far as history of hypertrophy scarring or even keloiding. Your ethnicity is very, very important. Again, it goes down to genetics. How it's taken care of after surgery, how the incision is closed during surgery. That's a surgeon's job. So all these things kind of taken into account when expecting a great tummy tuck scar. So the ideal situation is that the skin that's being removed is going to be removed appropriately, not too aggressively, and that the incision will be lower and more like a curve along kind of like the pelvis curvature. That's kind of my goal. The idea is you want a flat, tight abdominal tone, which we repair with the muscles, right? A nice good belly button and anatomically correct where it used to be, where it always will be. And the tummy tuck's going to be nice and low. Tension will determine the thickness of a tummy tuck scar. Most of the tension is created because we remove the skin and we move it down and we put it down low, is going to be right at the middle part of the tummy area. So it's going to be a little bit thicker there, and it kind of trails off as far as thickness along the sides. The tighter the tummy tuck's incision closure, typically the thicker the scar, and that's associated to the body trying to overcompensate to keep the incision closed. And so your body starts forming all this collagen and it gets a thicker scar. So as surgeons, we try to decrease this thickened, uglier scar by having absorbable sutures at multiple layers of the soft tissue repair to offset the amount of tension at the surface that you see. So we use absorbable sutures at multiple layers. Some of us use adhesive dressings to help further support the incision line, decrease risk of infection, like myself, and that again, it gives you another benefit of having better appearing scars. But it's really dependent on multiple factors. That's kind of the underlying issue. The idea is you want to do everything you can as a surgeon to make sure they get the optimal scar appearance. But after surgery, usually within about a month or two, we're going to start some kind of scar therapy, which is designed to further enhance the scar maturation, speed it up, decrease inflammation. So that's typically with a silicone product. So at 2 months, my patients are all recommended to start silicone therapy. And again, the purpose of it, we get thinner, lighter appearing scars over the course of its maturation, which takes about a whole year. So hope you learned something. Please continue to like and subscribe if you want some more. Thanks for following.